Hi everybody, welcome to our webinar today. Just going to wait for numbers to stabilise and let a few more people into the call, and then we will get going with our session. I just want to check, all of those who have just joined, can you just maybe pop in the chat to say who you are and where you're from? That's really helpful for us to know. Also, just to check that you can definitely hear me and that you can definitely see the slides on the screen. That's always good to check as well. So maybe pop something in the chat, that would be really useful. Numbers are still creeping up a little bit. We'll just give it another 30 seconds or so and then we'll get going. Okay, welcome everybody. As I said, thanks so much for joining us today as we sort of explore sensor technology and the care journey. My name's Fiona Flory. I'm from the Digital Care Hub, and I will just be doing a little welcome and run through housekeeping before I hand over to our panelists who have joined us today. So just a little bit of housekeeping. The webinar is being recorded, so everyone that's registered for the session today will receive a copy of the recording. Attendees, you are on mute and you can't be seen. However, please do use the Q&A function for any questions. We will be keeping an eye on that throughout the session, and we've kept a section clear at the end for us to pick up on any questions that remain outstanding as we come to a close. If for any reason we can't answer any questions, either because we don't know the answer during the call or because we run out of time, we will make sure that we pick those up at the end, and we will get written responses that go out alongside the slide set and the recording afterwards. So all questions will definitely be answered. As I said, please make sure you use the Q&A function for questions rather than the chat. It just enables us to manage those a little bit better behind the scenes. So, what to expect today? Little welcome and introductions that we're just doing now. We're then going to pass over to Bev from the National Care Forum. She's going to give us a really nice overview of tech, particularly sensor tech, sort of from a national scale. We're then going to hand over to our colleagues from Sensio. So we've got Anthea coming on first, and she's going to tell us a little bit more about their products, about some of their insights, which I think will be really, really interesting to hear. And then most importantly, we've got two amazing providers coming on to share their stories. So that will really bring the tech to life, their challenges, their benefits and their own experiences, which will be really, really useful. So we will welcome Jackie and Claire to share their stories with us. And as I said, at the end, we will go to a Q&A session. Just very quickly before we kick off, for anyone who doesn't know who we are the Digital Care Hub. We are a national not-for-profit organisation who support the social care sector with digitisation, but most importantly to do it safely. That is our very broad remit. If you haven't visited our website, please do. We have heaps of guidance and support. We have a helpline, case studies, newsletters, huge amounts of resources there that will help you wherever you are on your digital journey, and it is all free. If you can't find what you're looking for or you want to know more, do get in touch with us. Our details will be shared at the end, or you can do that via the website. So I am going to stop now, and I'm going to pass over to the lovely Bev from the NCF, who will do our introduction for us. Thanks,
That's
Bev.
great. Thanks very much, Fiona. Yeah, delighted to be here this afternoon. Really passionate about all technology in adult social care. And I'm very privileged position. I get to go out to lots of different places and see sensor-based technology in action. So this afternoon I'm just going to do a very quick introduction. So next slide. So just a quick note on National Care Forum, if you haven't come across the National Care Forum before. So we're actually the membership organisation for the not-for-profit social care sector. We currently have about 175 members, covering all aspects of adult social care. And we are delighted to say that they are delivering over 8,000 sites and supporting nearly 250,000 people. So we've got great coverage. And therefore we get lots of involvement with those members in terms of digital transformation. I am a very lucky person that I have a dedicated digital team at the National Care Forum, and we run a number of projects. So this afternoon, I'm just going to do a very quick introduction. Our fantastic speakers that will follow after me will give you the opportunity. We're going to explore and share the increasingly wide benefits of sensitive technology beyond kind of what people often see it as kind of falls prevention, falls technology in the care and support settings. I'll give a quick overview of the policy context, which I think is really important in terms of the ambitions and expectations of our current government and where does sensor technology sit within that. And then I was very fortunate to be part of an international tour to Oslo last year, and it was with Sensio. So I'm going to just share my reflections on the technology and my conversations with the people that I met during that tour as well. Thank you. So in terms of the policy context, so I remember this because it was my birthday on the 3rd of January. At the start of this year, we had quite a significant announcement from what was then kind of our new government that was kind of bedding in. And that announcement was that major piece around reforms and announcing the Independent Commission to Transform Social Care, so the Casey Commission. There's quite a lot in that statement that was issued on the 3rd of January. What the government also did for the first time, they were extending the funding for Disabled Facility Grant, DFGs. They'd increased that, they doubled the amount of money, 86 million. And for the first time, actually, they were now extending the eligibility to cover capital costs for technology. So that was our first, well, probably our only actually investment into tech. So that was part of the announcement. And then very importantly was the announcement of Baroness Casey being appointed to look at the long-term solutions and reform of social care. What we know is, and NCF amongst others are working with the Casey Commission team, is they quite clearly have been given a brief that digital is absolutely part of that reform that they're investigating. So we have that context in terms of what's happening over the next couple of years. A few months later, we then had Stephen Kinnock, our Minister for State for Care. And this is quite a big one, if you haven't heard this. So he has publicly said there's an ambition from this government for all care providers to be fully digitised by the end of Parliament. So by the end of their first term in government, that's their ambition, is to be fully digitised. And then we come on to the 10-year plan. So after consultation, the 10-year plan for health in England was published back in July. A very strong emphasis there within the plan on digital transformation. And there's a key promise to support the smarter use of AI and other digital tools to support care and decision making. What I would highly recommend is Digital Care Hub have done a fantastic response on that 10-year plan and kind of outlined the digital landscape a little better on that. So the only other thing that I would say is every announcement that we've had since this new government came out around social care tends to have digital in there. So it's not going away, would be my message. It's absolutely a very strong commitment and expectation from our current government around digitalisation in adult social care. And absolutely sensor technology, sensor monitoring sits very firmly within that expectation. So thank you, Fiona. So yeah, so I'm just going to give you a little reflection. So we took a number of our CEOs from our membership out to Oslo. Sensio very kindly hosted that tour last year. And it was absolutely fantastic to go to different care settings, go to a different country. Sensor technology has been around a lot longer, particularly in Scandinavia. They've kind of been using it for around 10 years now, while it still remains quite new for us. So it was great to go to different care settings, and I was really struck when I was talking to the staff teams as we were going around. And I was asking, would you go back to how it was before you had the technology? And it was a resounding, absolutely not. It's been transformational. So I just wanted to reflect on what they were saying it had done for them, and we will hear from our speakers later on. Absolutely, I'm sure, around the importance of better outcomes for people accessing services. But for the staff in those care homes in Oslo, what they were saying is they really felt that they had way more control and a much better, but much stronger overview about what was happening across the homes. And really critical, they had the ability to now triage to alerts. So rather than multiple call bells going and not knowing which direction to run to and who should go to which call bell, they were able to calmly identify what was happening with those alerts and, like I say, triage. So if there was an absolutely urgent, they knew where to direct staff to. So they found that very positive. And then this came out really strongly. Their experience of working had greatly improved because they were experiencing much reduced stress in terms of responding to those traditional call bells, emergency alarm. So the roommate system, and I know Anthony is going to talk about that later on, and it will have been moved on since last year, I know. What that enabled them to do is they knew what they were going to in terms of the alerts, and that for them had just taken that stress away. And people on this call, a lot of you will have experienced that. The bell goes, you don't know what you're going to. Is it, is it a life or death situation that you're going to? What is the crisis that you're going to? So they absolutely said that their stress had really reduced as a result. And then they also talked about the ability with the system to collaborate with colleagues dispersed through a building. And again, probably a lot of people on this call will recognise that. If you've got different floors, if you're in a residential care home, but also, as we saw in Oslo, they actually had dispersed buildings. So they had several buildings on a site. But the system, the roommate system, enabled them to, again, connect with those resources and colleagues across those sites. And that came back to the triage. You could actually triage and call people in from other neighbouring buildings as well. So it was overwhelmingly positive, which was absolutely fantastic. Thank you. Next slide. So I would end on, should you be introducing sensor monitoring? I'm hoping that's why a lot of people have joined the call this afternoon. And my challenge would be, we absolutely have compelling evidence now. You're going to hear this afternoon from the next speakers the benefits of introducing sensor monitoring. So my question that I would ask you to take away with you at the end of our session together today is, why wouldn't you be introducing sensor monitoring? And I will end there. Thank you. And please do reach out if you want to. Thank you. Thanks, Fiona.
Thanks so much, Bev. That was a great intro. We'll whiz straight over to Anthea, who will tell us all about Sensio and the product that you have available.
Thanks, Fiona. Thanks, Bev. I feel like you've set me up perfectly there, Bev. So thank you so much. That makes it a lot easier. So just a little bit of what we're going to go through in this session. So it will start with myself. We'll just go on to the next one, Fiona, if that's okay. So I'm Anthea. I'm Head of Sales and Marketing here in the UK. So I'm just going to do a little bit of Sensio at a glance for those of you that have not heard of us before. I'm going to focus a little bit on roommate and nurse call and all of the systems that go around that. So Bev's obviously mentioned roommate a little bit there. I'm going to go into the nurse call side of that as well, and actually how that all links together with everything that goes on behind the scenes, just so you know how the system works. I'm going to then pass on to Jackie from Dormy Care Communities, who's going to speak of her experience, and then on to Claire as well from Love It, who is going to speak about her experience with SenseTech. So try and give you a little bit of information about Sensio, and then hopefully Jackie and Claire, I know, will bring it to life in terms of their own experiences, which I think is probably the most valuable part of today. So I will try and flick through mine as quickly as possible. So who are Sensio? So Bev set us up pretty well there. The fact that we did a Norwegian trip over to Oslo probably gives you a little bit of information about us. We are originally a Norwegian company. We very, very heavily started in Scandinavia, and we account for about 60% of all elderly care providers in Scandinavia now that we support. So it's a big part of the Scandinavian technology development. And as Bev said, we've been going since 2009. So Norway and Sweden in particular, probably about 10 years ahead of us in terms of tech. And in the UK, we've been going for about 2 years now with Sensio. And there's some numbers up on the screen, and this is just to give a bit of context, really, because I think unless you've heard of us or interacted with us, sometimes you haven't come across us before, but we are a large company that invests a lot of money into research and development. And we have on here kind of 900 plus facilities served. And the reason we don't just talk about care homes here is that in Norway and Sweden, it's a very different setup in terms of funding. And, you know, it is government funded from start to finish. So there's a lot more focus on staying in your home longer or being in hospital for less time. So that in Norway and Sweden could look like lots of different things, from home care to hospital. In the UK, we're just focusing on care homes at the moment. So yeah, a little bit about us. Thanks, Fiona. So what do we actually do? We would class ourselves as a platform for improved decisions based on data and insights. I'm going to take you through a little bit of that today. So there's some screenshots on here, and I'm going to talk you through each of these systems a tiny bit before we dive into Jackie and Claire's experiences with these systems. So if we go into Roommate first and kind of how it works, you've got Roommate in the left top corner here, and this is the sensor that sits in the room. Now, this is really important because one of the things I'm going to talk about today is it is a sensor and not a camera. And that is probably the question we get asked more than any other question, so I'm going to preempt that before that comes up. And how that works is it's a infrared depth sensor, so it is not a camera in the room, it's not CCTV, and I think that's really, really interesting when we get into that conversation in a little bit more detail. That also links into an integrated digital silent nurse call as well. So what that means is that these two systems I'm going to talk you through all come through to the same handset, and Bev referenced kind of that being able to see one true picture of what's going on in your home. That sits on lots of different platforms. So for the care workers, they would receive all of that on their handsets. If you're using people like PCS or Nourish, it would be the exact same handset that they're already using for that. And then what we've got behind that is a whole base of reporting and platforms and analysis that supports senior team members, managers, senior managers, group level. And I'm not going to talk through all the reports because I could spend an hour going through all of those. But what I am going to touch on is two systems today called Vista and Insight. And hopefully they'll bring to life for you a little bit of how we use some of that data to pick up on the extra benefits in the care journey and not just the falls prevention side. However, it would be wrong for me not to talk about falls prevention at all, because we are in Falls Prevention Week and we are, you know, traditionally known for falls prevention. So Fiona, if we go on to the next one, I'll talk through Roommate a little bit. And I had a really interesting story the other day on Roommate, which always makes me smile, is that we were doing resident sessions with relatives and residents in the home to talk them through Roommate, and a gentleman had had his invite to the meeting and he said, I honestly thought I was getting a roommate. I'd got ready to have a second person in my bedroom. It is not a roommate. You're not actually getting a second person in the bedroom. So Roommate is the name for the sensor, and the sensor is predominantly falls related in this setting. So this is what we would call falls prevention, not just detection. So we're not just telling you when a fall has happened, but there is lots of alerts that happen to stop the fall from happening in the first place. And that's the aim here, is to prevent the fall. So you can see a lot of alerts on here. Now, I think what's really important to mention here in the care journey is that for every single resident, these alerts can be tailored. So this is not the same set of alerts for every room, every bedroom, every resident. These can be completely and utterly tailored to each person. So as someone's needs and care journey develops, these can be increased or decreased. You can adjust the sensitivity on these. So you might have, let's use Bev and Fiona as examples. If Bev was higher risk of falls, we might have everything set up for Bev because we want to know if she's getting out of bed or she's sat up in bed, because that might lead to Bev trying to get out of bed, and that's when she might need the support to not fall. However, we might have Fiona, who is really, really independent in her care journey, and actually we just want to have fall and loud sound on. So we would know if Fiona had called for help, or we know if Fiona had had an actual fall. And that is different for everyone, and it is different for everyone's care journey. So I'm sure Jackie and Claire will talk about this, but in a 70-bedded home, no one resident is the same as the next, and neither is their Sensio alert system. But the whole point here is, if someone is at risk of falling, you can set these alerts and change the sensitivity to alert you before the fall happens. If we go on to the next one, And this is kind of how we talk about a bit of a digital journey. So what would happen is the alert would go off, it would go to the care team's handset. They'd be able to go and do what we call a digital check. And this is where you can go into the room and see what's going on. So these kind of describe it a little bit as the floor is lava when we do training. So the yellow is the floor and the blue is the person. And you can see here, you're not seeing the room as such, but you are seeing the markings to know what's going on with that person. So in the left picture, the person's up and walking around and has got up safely. They do not need your intervention in that scenario. On the right, though, we can see that a fall has happened and obviously you need to attend. So it's the ability, as Bev said, to see what's going on and knowing how to respond to that urgently. But I think for people's care journey, it's also, someone described it to me the other day as not over caring when people don't need it and trying to keep people's independence for as long as physically possible. They might not need you to enter the room every single time, but actually you've got the ability to check, are they safe without me going in? So if we click on to the next one, this is the wireless nurse call. It is silent, it's wireless. The really, really lovely thing about this is we all know what nurse call systems are, we use them every day, but this connects directly into your Sensio alerts. So they would go into the same handset that your sensor alerts go off in. You get all your reporting in the same place. You know what your response time is across the board, not just with nurse call where someone's calling for help, but also when the sensor's telling you that they might need help in advance. So everything goes into one place for your care teams. They're not using different applications. And from a management reporting and CQC and regulation point of view, you've got all your data really clearly in one place. Thanks, Fiona. And a step on from that is integration. So I spoke a little bit about Nourish and PCS, but actually what we can work with you to do is integrate those notifications into your actual care notes. So for a lot of care team members, and Bev, this is what we hear in the UK a lot, is people are like, it makes my life so much easier because I put the note in as soon as the event has happened. I haven't got to try and remember what happened later on. I can say I've dealt with it and I put it straight through. And this can be completely tailored again. So you could have lots of things that are compulsory and you could have some things that are optional. But all of this is about making that process as seamless as possible. One, for your care team, but also for your residents. So everything is as clearly documented as possible for them in their care journey as well. Thanks, Fiona. So this is a little video and I'm going to talk over this, and we have slowed it down so I can talk over it, and I need to not talk too quickly now. So what you're going to see is on the left hand side is what we call Vista, and this is the digital view, and you can do this on a phone or you can do it on a PC. And what's going to happen is this lady's gone into the room here and the alerts are coming through on the handset. So she's got out of her chair, she's gone in the bathroom. If you had a door sensor on, it would tell you there was a door sensor. In this scenario, the lady is in bed, and you can see that she's called Angela Lansbury, so she's going to be very dramatic for me in a minute because she's one of my 21-year-old colleagues, so it was very dramatic with her fall. But you can see she's upright in bed, and now she's going to stand up from the bed, and then she's going to have a fall. Now, obviously, that all happens very quickly here, but this shows you in a very, very brief snippet what the care team can see on their handsets and what they can see if they're doing a digital check as well. So in this instance, you're getting the notifications before the fall, and you're able to do a digital supervision to see what's going on in the room. I feel like that's the best way to bring this to life, is that little snippet, so it's always worth putting in. So what goes on behind the scenes? So you've got your nurse call, you've got your roommate, that's kind of like your kit side of things, and you're getting your notifications to your handsets. But what else is there? So at the core of everything we do is a system called Sensio 365, and this is where everything integrates into one place to give you a full picture. So if we just go on to the next one, Fiona. This is what we call Vista, and I think Jackie, one of your homes in particular, said this was like their superhero tool, because it gave them the ability to see everything in one place. So for managers and seniors, and especially teams on night shifts, this cross-divisional working, this can be set up for the whole home, it can be set up for a floor, it can be set up for, you know, a hamlet or whatever you might call your little houses. This can be completely adjusted, but it shows you what's going on. Now, there's a few things here. One, you've got a really great view of what's going on in the home. But also from a management perspective, if my alert has been going on for 7 minutes and my target is 5 minutes to respond to a call bell, I can see that I'm over in Judy Dench's room. So it actually gives your managers the ability to review everything going on in the home and how long those alerts have been going on. From a team perspective, it is that I've got the picture of what's going on in my home. From a resident perspective, it is giving them the best care they could possibly get because we're responding as quickly as possible and people have got eyes on what's going on. So if I need help, I know that that's going to be seen. I think what's also really important with this is not everyone is able to use a help button or a pull cord or all of these kind of physical things, but where the roommate links into this with your fall alerts and all of these alerts have sat up in bed, especially for residents living with dementia, we're hearing more and more about how this is a huge benefit for them in their care journey because it's not reliant on the resident being able to call for help themselves. Someone will still be able to respond if they need help. And I think Jackie and Claire are going to come on to a little bit about formats later and the benefit of not having formats, but there's a real benefit here with residents living with dementia that they've got that support even when they can't necessarily ask for it. And obviously that's not the same for everyone, but we are hearing more and more about that. So that's a little insight into Vista. And what you can also do from Vista is planned digital checks. So I'm sure everyone on the call will know kind of the standard of doing manual rounds of checks and going into people's rooms. And for some residents, they're always going to need that manual check. That doesn't go away. But for a lot of residents, they don't need to be manually checked every 2 hours or every hour. So what digital checks allow you to do is to do planned checks, and these can be fed through into PCS and Nourish as well. So they can directly go through when you've done a planned check and you can put your notes on, but really useful for teams. And I know I don't want to steal too much of anyone's thunder, but this does mean less disruption and we see better sleep and overall improved well-being. So yes, you've got a falls prevention system there that alerts you before a fall happens through different methods, but actually just improving people's sleep and well-being means that they're less likely to have a fall. People eat better, they sleep better, they're more active during the day. All of these lovely holistic things that go around it that often get missed in sensor technology because it's just seen as falls detection. So I just think it's really important to highlight that. And then this is the most exciting part of the whole system for me is Sensio Insight. So if we just click onto the next slide, this is learning about your residents' behaviours, and I'm not going to go through every scenario here, and I know that Claire has probably got some scenarios that she wants to talk about as well later on, but actually this is looking at what my routine is. So me as Anthea, when I go into a care home, what is my normal routine? Not what do I think is the norm for all my residents, but actually learning about me. So when things start changing or you've got a new resident, how do I learn what the normal routine is for that person for me to care for them in the best way? What time do they naturally wake up? What time do they naturally have a break in their sleep? Have their bathroom patterns change? Really fantastic example here was UTIs being picked up earlier than ever before because people had seen bathroom changes. Other things like medication changes. We've changed medication, someone's sleep has improved, or it's got worse, or there's more activity in the room, so they're more active, or they're more lethargic and in their chair in the room more often. All of these things that, you know, we would never be able to see that as a human being, but actually gives you the power to give the best care possible and truly person-centered care. You're adjusting your care to that person and that person's routine. So Insight for me is the coolest part of the system, but I'm probably slightly biased on that. And this, if we just flick through these 3, and I think there's 4, but this is kind of what the teams would see. So they'll see key insights, what's changed as someone's sleep massively changed one night to the next, what's the changes over the last week. It'll also show you how long your care team are in the room. So we use tags. So you basically get your phone, you tag yourself in or you mark yourself present, and that will show you how much care someone's had one-on-one in their bedroom. Now, a couple of really interesting new cases here is one, seeing someone's change in needs potentially. So when they first came in, did they only have X hours and now they've got Y hours? That's also really helpful for funding, local authority, fee increases, all of these areas where someone described it as professional best guess to me the other week, which I loved. You know, they said it's my professional best guess, but I don't have data at the moment. Actually, what this gives you is hardcore data to say our hours have increased by 50% in the last 4 weeks with this resident. So that person's needs have changed, you know. It also tells you all the alerts and shows you when digital supervisions have happened. So you've got a true picture of that one resident in one place and the data to go behind it. And then I'm going to hand over to Jackie. Thanks very much.
I did it earlier as well. I was on mute. So thank you, Anthea. A pleasure to be invited to be speaking on behalf of Dormy Care Communities about our experience with Roommate and Sensio. So yeah, I'll just try and go through a little bit of anything. So any questions, feel free to put in the chat box, and I think Fiona will be managing that as well. Okay, so, next slide, please. So we've got 5 homes under Dormy Care Communities. So we've got Fox Centres in Abergavenny, Brockington House in Hereford, Glenburnie Lodge in Wenford near Cardiff, Bramshot Grange in Liphook, and then Pine Martin Grange in Wareham near Dorset. So we've got, a wide range of homes within that. We've got in the 5 homes we use roommate in all of them, and in the 2 homes in the south of the area we actually have the call bell system in place as well. So that gives us a lot, that will give us more data than obviously we have in the other 3 homes as well. Next slide, please. So why did we look at sensor-based technology? Anthea touched on it earlier. It's, we've all known traditional sensor equipment over the years, predominantly, falls mats at the side of the bed, which are a trip hazard in themselves. Or the wires that trail everywhere, you can have sensor beams, things like that, which are not that reliable. So, with the technology moving forward, we looked in 2023 to trial roommate in one of our homes in Fox Centres in Abergavenny, just for 6 months in one of the communities. It was actually our dementia community where we had a high level of falls. And so we trialled this just for 6 months, and it was on the real basic settings, because this is when roommate, in the UK was really just setting out. So, it was more or less just falls system at that point, and were we reducing it? What was happening? And we found that in the 6 months we reduced falls by half because of the alerts that were being in place. So yeah, alerted the staff. So that was really, really positive. So on the back of that, we introduced it across the remaining 3 homes and then into Glenburnie Lodge at the start, because they opened in June last year. So we put that in from the start and in that home. So yes, we're very lucky that we've got this in place, because it has really helped with falls prevention. And what it also helps with is evidence for CQC and CIW, but also when perhaps we've had safeguardings or complaints from families about perhaps what level of care and support their residents have had, and we've been able to evidence, when alarms have gone off, what we've done, what our response times were. So that has been really, really useful. And I think in this day and age, as we know as providers, that if it isn't written down or isn't done, then how can we prove that? So it's really, really essential moving forward that we can evidence that we are supporting people in the best way possible with that. So yeah, so that's why we sort of looked at sensor-based technology. So really good. Next slide, please. So yeah, we had, I think when I was asked to do this, we had a sort of a questionnaire from Sensio about, what sort of things, what's the positives, what could we do better and everything. So I sent that out to the 5 homes to gather their information. I completed one myself. So we had a lot of information through. And I think we had over 100 benefits, was it, Anthea, that, people had said, which is an awful lot, so it's been really, really positive, reduce the risk of unwitnessed falls, with just having the out of bed alarm on, which has been amazing. We know, so somebody before they even stand up, we can get them out of bed, or the sit up in bed function, which is very, very helpful. And what we've decided to do as a company is to have, when somebody new comes in, to have the highest level on, so that we can actually get used to people, as Anthea said. We know what is their safety, when are they likely to fall, can we get there, intervene first. So it's getting that real range of information from people to try and reduce all of those falls. And then as we get to know people, we reduce them back down to what is suitable for them. Do they, are they really able? So we just have them the lower setting. And I think what we really like as well is the bathroom check as well. If somebody has been in the bathroom for longer than 15 minutes, that alerts us as well to go and do just a welfare check, just to make sure everybody's okay as well. Because obviously the sensor doesn't cover the bathroom area. It goes, it covers the door area and people leading into that. So that's really good. And obviously the alert when somebody is on the floor for whatever reason, we've had perhaps not falls, but perhaps somebody slid down from the chair onto the floor, that will alert us as well. So that's also good, because obviously that person needs support at the same time as well. So it isn't always about actual falls, it's about perhaps people need that extra little bit level of care as well. One of the other things that we really like is the loud noise alert, which, as you say, sometimes people, haven't got the ability to use the call bell, but, perhaps they can shout, or, you perhaps hear that perhaps the sensor is there, and people can go and check, make sure somebody doesn't need any additional support. So that's been really helpful as well for some of our ladies and gents. You can see, obviously, there's lots of slides on there as well, which I'm sure you've read as I've been talking. But yeah, improved night monitoring is useful. And, what we do, we don't use that as a tool to stop us checking on people in the night, because that's really, really important. Because I think that was one of the things we were a little bit afraid of when we first introduced it, that would people then, would the staff just say, oh, well, I'm just going to check on people through the, just on the sensor, so I don't actually have to go and do a physical check. So obviously that was very clear in the beginning, that it had to be an agreement and in a person's care plan of what level of support they have at night. Some people, it was really useful because they didn't like to be disturbed, so that was really helpful. And then others, as Anthea said, we do need to do a physical check at night. So this again is a mixture of whatever works for people as well. It's all down to people's individual needs and the risks associated with them then. And then, we've had a lot of data analysis. It's just how this has improved, from being at the start of, roommate in the UK, with the amount, I'm just amazed by how much it's progressed in the 2 years. It's all the information that comes through now, and obviously it was very basic in the beginning, but obviously we could see the reduction of falls from obviously what we were monitoring and logging. But the fact that it logs everything for us now, I get a weekly report on a Monday with the last week's, with the falls, what they were, response times to those falls. The 2 homes have got a call bell system in place, the response times to that, how many falls they were, and the average response time. So that's really good, and we have that, and it goes back, so we can see, has there been any difference from the week before? Have the call bell times gone up, or have they gone down? Because obviously what we're trying to do is make sure that these keep reducing down. So then we can have those conversations, and there's data attached to that. The homes also have a weekly meeting with one of the ladies from Sensio. So they do that on a one-to-one basis, so they can talk about any issues, anything that's flagged up by Sensio that we feel that we need to look at, any problems from our side. So that is really, really helpful, and that's helped to develop everything as well. We also, myself and the CEO, have a monthly call with Sensio, so we just have a catch-up at new initiatives and where we're going with that, and what homes possibly would be trialling new initiatives as well. Yeah, I'll talk about that now. I think I was going to talk about it in another slide, but I'll talk about it now because I've gone on to it. I've got my notes here. So yeah, we've got Fox Hunters in Abergavenny. They're actually trialing the AI platform. So that works with the bedroom layout, as Anthea showed earlier, where you had the orange and the blue. So on the PC, you would actually set out the layout of the room. So you do the bed, the chair, and have that. So that's the area that the sensor is covering. So you can change that. So it's in the right place, and you regularly have to go and check, because sometimes, obviously, when housekeeping have been in, that might change with the bed or the chair or anything. So what the AI mapping is trying to do is obviously prevent you having to go and do those checks. It looks at where that would be and where you would alert, and if there's any changes. And that would flag to the home director, and then she checks that off. There's a couple of, it's not perhaps working 100% as yet, because sometimes it's flagging that there needs to be a change, and when they go in, actually, it isn't, it's okay. But we're working on that, and obviously we're flagging when that isn't correct from our point of view in relation to what the AI is suggesting. So that's been worked upon as well, but obviously the changes of that all of the time. So that's really good. We've also got another home using the Vista system, as Anthea said earlier, and all of that system on there. And what actually we had initially was just room numbers on that system, on the tablet or the screen that's in the care hubs, which the staff use. And we put on there obviously names on that alongside the room numbers, which has made it a lot easier for people to recognise, because obviously people do change rooms. We have people who come into us new and obviously people who leave us. So it was much easier for staff to recognise that, who needed what support, and obviously their patterns of behaviour as well. So that's been a real positive. And then we've got another home, Prime Martin Grange, which have just last week been asked to look at the fall sensor. And we talked about earlier about the sensor is infrared sensor rather than a camera. But within that, what they would be looking to do would be turn on to the live function of when perhaps people are at really, really high risk of falls, and we don't know why that is happening. So looking at it would only become live and send that information when a fall is alerted. So you would capture however much, a couple of minutes perhaps before the fall, and then obviously a couple of minutes after, and that would alert. That live data then only stays within the sensor. It doesn't actually, it's not stored on anything else, so it just remains there. So that would help to hopefully capture why somebody is falling within that. So that's something we are looking into at the moment. We are interested in it, but we're looking obviously with the privacy, dignity, dolls as well around that. So obviously we've said that we're going to have those discussions and then go back obviously to Sensio with that as well. But that's another aspect that's come on board. And I think what you get with Sensio is it's the partnership working, that you're looking at things where how is this going to work for you in the home? How can we improve it? The weekly calls show that. Yes, we're happy to trial things, but it's for our benefit and for others' benefits then. So that is working really well, the partnership, and yeah, really, really good. So anyway, next slide, please. I think I've talked about that for long enough. So top tips. So these are from our teams on the floor. So what's really important, I think, from the manager's point of view is involve your team, get them on board. There was a lot, when we first trialed it, people were very wary, oh, it's a camera, it's going to be recording what people are doing, and I think we had to make that really, really clear and make sure that it was really safe for people. Because when we talk to our families and our residents, obviously, we had to explain that, and obviously there's the safety around that for privacy and dignity. Choose a solution that enhances care rather than replacing human interaction. So as we said earlier, it's about doing the extra things that we can do. It's not replacing what we can do, but we can't be in that room 24/7 watching and supporting people. So this alerts us when people need that extra level of support. Make sure it integrates smoothly into existing systems and does not add unnecessary workload. Ask about interfacing with other platforms such as PCS. That we're hoping that we're going to start interfacing with PCS soon. It's already set up to be able to do that with Sensio. So we've just got to agree that with PCS now and get that system on board. What has happened, one of the ladies in Sensio that we work with on a weekly basis, she's actually been working and looking at our PCS as well, so that she can interlink that. So we've got that data as well working with us. But when it actually interfaces, that will obviously be a lot easier for us to do. Always consider residents' dignity, independence and privacy, and that, foremost, that is the most important thing. And I think, you need to feel reassured that, the roommate sensor is actually doing that as well. I think come and look at how neat, discreet it is, and understand it's not a camera and a video. So yeah, I think come and look, come and ask us if you're interested. We're happy to, to show people what we do, and we are sort of around the country, so it may be suitable for people, or there's other companies out there, providers that actually have that in place. Come and see it and try and understand it before you put it in, if that's what you're interested in. Ensure your training is robust and in place prior to commencement. We did have a lot of training. We had a gentleman who came in and he came down for a couple of days at a time when we were introducing it. He'd set up all the roommates. He involved maintenance and the home directors and the teams. And he would come in and he'd sort of work with the day staff. He'd come back later, he'd work with the night staff. And he was around and he was available locally, so if anybody needed anything as well. So he was there for a good few days, trying to capture all of the team. So that worked really well. So everybody was on board. Everybody had that training. Nobody missed out on that. So that was really, really good. Explore all options that are available. As we said, there is so much now that is available than 2 years ago. So many systems. So yeah, you explore it. Find out what it can do for you and your residents as well. Ask to see them working in another home so that you can understand how this works and also hear testimonials about the positive or negative impact on the lives of the residents. And I think we covered that earlier. Next slide, please. So this slide is about feedback from our staff, home director and relatives. Obviously, we had a lot more feedback than this, but the team is saying we can respond quickly without just constantly disturbing residents. So it's that not having to pop in every 15 minutes or something. If somebody's on high risk of falls, you have that alert so you can get there as soon as you can when somebody needs you. Giving relatives saying, gives me peace of mind knowing that dad is being monitored safely without compromising his dignity. Home director, protecting all of our ladies and gentlemen's privacy and dignity is paramount in a care home. This amazing technology allows that each room can be set up for the individual, but still encourages independence. It is very discreet, no noises in the rooms, and the option to see the situation anonymised on the handset device, also useful at night for checks. And that's one thing I didn't touch on, as Anthea said, we've got handsets in place. So every care staff has one of those. So the call bells would come through to that, as do our call bells that we use. We use a different contractor in 3 homes. That comes through, and also the roommate alert comes up as well, and obviously tells you what that fall alert is, and you can see that. You can quickly look at the view, the anonymised view as well, to see what the situation is as well, so you can quickly go to that. Next slide, please. Oh, one more. It's amazing how quick we all got used to it. So I think nobody likes change, and especially technology. And I think, some people, they find it hard to do that, but the system is really easy to use. And I think the fact that it links to a handset, which I think more and more care homes are doing now, everything is becoming electronic. It's just easy to use, and it's just all links together. Okay, next slide, please. Oh, one more. It keeps on surprising me. The visual overview of all 70 rooms has been invaluable. It gives us immediate insight into where attention is needed, allowing our team to respond promptly to any situation. And you can see that on the slide that Anthea showed, where you had the 70 rooms there, and it will flag up straight away. So if you happen to be in the care hub at that time, you can see there's a red alert, or people are green if they're in the room, is happy, and then amber as well. So you can see that quickly without looking at the handset as well. So definitely next slide now. So, mentioned earlier that the technology continues to develop, and we are working in partnership with Sensio, and we're hoping that's going to continue as well. And I talked about, obviously, the PCS earlier, and what our homes are trialling as well. Yeah, so that's obviously covered earlier. So finally, I'm just going to say that this overall has been a really positive experience with Sensio. They work with us as a team to ensure that we tailor-make what's the needs of the residents and how that's going to support us as providers to ensure people, have the best life possible, and the best well-being with improved sleep, less falls, and obviously less injuries with that. So yeah, thank you. So definitely worth a look, in my opinion. Thank you very much.
Thank you so much, Jackie. That was really insightful. Great to hear sort of your first-hand experiences. There's just been a couple of questions pinged through in the chat, so we'll pick those up as we go along. So I think they're things that between us we should be able to answer as we go along. This might be something for a few people to input. So Claire, Anthea, if any of you have input, feel free to answer this one. So the question was, there is resistance to what is Big Brother watching. How intrusive is the system, and how much personal or user input is required?
Well, I thought that initially. I was really concerned about it being a camera. And I think initially, when we had it, I think the live view could be there, and we were really adamant that shouldn't be there, and we had that switched off at a very, very early stage, because we didn't feel that was necessary, and with the privacy and dignity, it just wasn't acceptable at all. So I'm reassured that that isn't, it's very unobtrusive. You can't see anything other than obviously the blue person. Obviously you could see in the bed that person, was very different there. It's not obviously highlighting anything there. It's not constantly on view. It only flags up if there's an alert. So, and people have got to agree to that as well. It's not just put on across the home. We speak to people and we ask them if they would be willing to have that in place. Obviously people have to, if they've got capacity, they will consent. If not, we will obviously discuss if somebody's got a power of attorney, obviously for health and welfare, to see if that's what they wish to do. So, we do involve people within that, and we ask the questions. And there's a lot of people in the homes as well decide they don't want it. And they say, no, it's fine, I don't want support. And I don't want that, the checks on me during the night. So that's acceptable as well. So I think it's individual needs and it's not forced upon anybody. I hope that answers the question.
Thanks, Jackie. That was really helpful. Anthea, I see you've got your hand up. Do you want to come in there before we move on to the next
Just
question?
one small thing on this as well is that when you mark yourself present in the room, I spoke about the presence earlier, when the care team member's in there, it actually pauses the sensor completely. So although it's not filming at all, although it's not doing any of that stuff, this big brother kind of mindset is always there. And one of the things is, as soon as a care team member puts themselves as present in the room, and that can be done on a wall panel, via the phone, via NCF tag, that basically, as soon as you've done that, pauses it. So no footage, you can't go and do a live view on the room, you can't see any alerts coming through. So one, that's a really nice side of that. Then family members are in, because they can pause the sensor if they're having a visit. You can pause the sensor every time you've got a carer in the room doing personal care, and whenever anyone's in the room. So basically, when anything like that is going on, the sensor pauses anyway, and it just marks it as present time with someone in the room. So that does often help with that question about Big Brother, because it's not there watching the care team or your resident when they're having all that stuff done. It's there when someone's not in the room, to give that extra support. So that often reassures people a little bit, I think.
Thanks, Anthea. That's really helpful. A couple more that have come through as well. Did you have any Wi-Fi issues when all systems were set up? Were any upgrades to infrastructure needed?
We did have some Wi-Fi issues, and we've had to put different routers and boosters at various points in corridors or sort of stairwells, just to increase the Wi-Fi system. But that's more linked to the handsets, because the sensor is hardwired in. So we did have to. A couple of the homes sort of channeled out walls and embedded the wires in. Other homes just, put the plastic tracking around. And the newest home we did, actually, we had that set up completely. We had a plug at the top of the room where the sensor was, because we were doing that from new and we were still in build. We were able to change that. But yeah, there's various ways you can do it. You can, obviously you've not got to put that wire in up, because you don't tend to have a wire or a plug, sorry, at the top of the room. So that can be tracked up, and it's just a Wi-Fi just for the handsets. And I think we'd probably looked at that before that anyway, because we use the handsets for PCS and call bell alerts anyway. So, but yeah, it can dip as you know.
It can also use Wi-Fi, and some homes have great success with it and others need
Oh, okay.
some new things in. But we do a site survey where we do a Wi-Fi survey before anyone goes live. So we will say, you need a bit more infrastructure here, or what you've got is perfect. And if I'm being really, really honest, outside of Sensio, so much is going towards tech, through things like medication, through digital care notes, through our residents being more tech savvy and watching more stuff and streaming more stuff. So I think for a lot of homes, they're having to put extra support in. Like Jackie says, these guys have hardwired theirs in. That's always the dream world when you work in tech. But in a lot of cases, it is about Wi-Fi, and it's building that infrastructure, because because as you put more systems on, you know, it might not be Sensio that's the problem, but when you put your next system on, you might then struggle. So we will work with all of our customers on that, because we know and we see that becoming more and more of a challenge as more goes tech direction.
Thanks, guys. That was a really helpful answer. Okay, final question then before we pass over to Claire. Is would a capacity assessment and best interest decision be required for each individual?
Yes, I think I might have covered that off perhaps before the question came in. It would always be an individual basis. You know, we offer it to everybody. And even if people are not high risk of falls, it can be useful because there are occasions when people will fall, or perhaps whatever there may be. But a lot of people say no, and then you know there are people who really want that, and if they haven't got the capacity to consent, then obviously we do have that conversation with power attorney professionals and do the best interest for that person as well. Then the same that we'll have to do now in relation if we have people with high risk falls, where we want to do that live sort of minutes before a fall. That will help us to identify why people are falling. So that again, that will have to go through DOLS. And also, if somebody's not got capacity, we have to put a DOLS in for that, because obviously it is a deprivation of liberty because we've got the sensor in the room as well. So just a reminder about that. Thank you.
Thank you, Jackie. Amazing. We've got one more question pop through, but I'm actually going to park that until the end because I thought it's a bit more of a sort of generic question. I'd like to make sure we definitely capture really great insights from Claire. So we're going to pass over to Claire now, and then we'll pick up any remaining questions at the end. So thank you, Claire.
Thanks, Fiona. So I am in a care home today, one of our homes. So if there is background noise, I do apologise. So my name is Claire Richards. I'm the regional manager for Love It Care. So Love It Care have recently acquired a further 15 homes from New Care. So we now have 28 operating homes in the business. So very, very busy times. So we initially looked at Sensio and Roommate with one of our homes, which is nursing and residential. And from our governance data, this home had a higher percentage of falls with injury. And when we were drilling down on the analysis of the falls and how the injuries occurred, the data just wasn't available. It just wasn't available. So with one of our first homes, that's when we went over to Sensio and we trialed it there. And well, yeah, worked really well. Worked really, really well. Next slide, please. So yeah, so we had a clear reduction in falls. And once we'd been through all the data and analysis, it showed over a 6-month period we did have falls, but none of those falls occurred with an injury, which is massive. You know, the home's a 70-bed home, really, really busy, full home. So that gave us a better oversight and analysis. The digital supervision allows the team to respond without the panic, you know, and prioritise which resident needs help first. I think that's one of the major things. And if there is an emergency, they go to digital supervision straight away while they're heading to the room, and it saves this panic-stricken running around the home. So, you know, it did improve that and gave us a more proactive approach to falls, infections, as well as prompting. I'd say a big thing we noticed was residents' sleep, that they were just sleeping so much better. Some residents preferred, like Jackie said, some residents preferred not to be checked all night, but obviously we still have to physically just pop our heads in and stuff. But even down to nutrition, fluid intake, just the whole general well-being and the energy during the day. And again, falls, that also has an effect on the falls. Next slide, please. So, as we all know, technology is only as good as the people we educate to use it. So we had so we were supported by Sensio physically. They came into the home, really, really supportive, you know, sat with each staff member. Some of your staff will learn faster than others. You know, some are really tech savvy, some aren't. So that time is spent with them, and, you know, that really showed, because then that has an effect then through your care planning, your risk assessment. So things like that enables that staff team to be able to implement that into your care plans as well. In the home, what we noticed was, as our clinical governance as well, when we were doing clinical governance, an overview of the home, so not only falls, infections, and just the whole well-being of residents, wounds, everything, it had an effect, it had an improvement. The data showed an improvement right over resident well-being, as well as preventing falls and preventing injuries. So next slide, please. So Regency, like I said, reduced the falls after installing Sensio in the home, and the governance report, which is obviously our analysis, clinical governance and governance overview, showed that since installing Sensio, the monthly average fall rate decreased each month, and has in total reduced the falls rate by 70% from January 2024 to January 2025. I'm sure you'll all agree that's, you know, that's a massive improvement in a very, very busy home. The report highlighted the importance of Sensio and it providing safer environments and reducing falls in the home. Next slide, please. So yeah, like I say, we have fewer falls. It helped us with our response time. So rather than just faster response times, it gave more of a proactive approach to response times, better night's sleep, enhanced well-being, like I say. And just a more homely atmosphere, because I think in care homes, when you have the panels on the wall and it's bleeping and, you know, the residents' rooms coming on there, that also is it's dignity, it's disruptive to the other residents. And as well, you know, we had a lot of residents saying how they were getting a better night's sleep because they couldn't hear the nurse call bell system going all night, just bleeping, you know. That really improved. I think with our new commissioning home, when we were showing families round and new residents, we already had the Sensio sets installed in the bedrooms. And I think showing them and pointing out, oh, look at our sensor that we've got in place, giving them the handout, explaining the system, it sets you apart from the other residents. We had so many people who came to look at the home. Mum or dad was in another home, and they were, you know, falling quite a lot. And once we told them about our system, it set us apart from the other care providers, really. And we had the data from one of our other homes, Regency, to show it actually does work. Next slide, please. Well, that's it. That's
Thank you, Claire. Unless there's anything else you want to share us, don't feel you have to stop there if there's things you haven't said.
No, I think for us, I think it's obviously the reduction in falls, but the overall resident well-being that's improved. I think with your team, they can find it difficult to move from a system where you're just looking at the, you know, the alarm bell goes and we go to the panel, embedding that into your team and helping them understand the system it's the same as any new technology in the home, isn't it? You know, we have to work with it. And if all of our staff were on board once they knew all about the system and we educated them about the system, and obviously training we were really well supported.
Thank you so much, Claire. That was really insightful and, great to hear sort of a second example of the amazing benefits that Sensio's brought to your setting. I've got a couple more questions in the chat. If there's any more, please do send them through because we can use the final few minutes to sort of pick up on those. First one's actually aimed probably more at Anthea, but has the system been trialled in a domestic setting?
Yes, but not in the UK yet. So in Norway and Sweden, Norway in particular, this is very, very heavily used in people's homes, in the efforts to keep people at home for as long as possible. We're not there yet in the UK. Never say never, but not yet here. We get asked that question a lot. Yeah.
Thanks, Anthea. And just from our perspective as Digital Care Hub, we are not here to promote Sensio entirely. This is an amazing example of sensor tech. There are other companies out there who I think are more aimed at home sensors. So there will be similar technology that is more home-based. But as Anthea said, for Sensios particularly, it's not yet, but potentially in the future.
Yeah, and there's definitely some fantastic tools out there in the market. And the one thing I would say that kind of is a bit different about Sensio and I would encourage you to look at is that camera versus sensor thing. I think probably Jackie, Claire, you're probably, everyone's nodding here, but, really have a look at that as well. But what I would say is there's loads of fantastic tools out there. We went to iTech show earlier this year and the room was full of various tools and pieces of kit that are out there for people's homes. Yeah.
Thank you so much, Anthea. Okay, so what are the barriers for data integration from remote monitoring tools and care planning software?
Oh, good question. In terms of I'm going to take this question as in terms of integrating other systems out there. For us, we're an open API, so for us, it's very, very easy to connect different systems in. Obviously, when you're connecting different systems, you do need everyone to be willing to share data. And I think probably Jackie, Claire have both been through or are going through different integrations. So Jackie has got some integrations, I believe, with, is it Boost going on at the moment as well with your learning platform? Claire has been through that PCS journey as well. So I would just say the key thing here is bring your tech people together. That would be my request. Get us in a room, get us talking. Most people working in the care setting, I know from Sensio's point of view, and I can't talk for everyone, but we want to share data in the best way possible for the best outcomes for residents and for our customers and people like Love It and Dormy, so if you can be that facilitator to kind of get those people in the room talking together, that can be really, really useful because it's super powerful coming from a customer directly or from a care provider. And co-creation for us is massive. So, Jackie and Claire have both been involved in co-creating what's next for Sensio, and that might be an integration part, but you need everyone to be willing to share and doing that data sharing safely. So yeah.
Thank you, Anthea. And just sort of a follow on from that has also come through in the chat is, will the Data Use and Access Act 2025 have an impact on your data strategy and how you approach that?
Yeah, we have a data director in the company who would be far better placed to answer that question than I probably am. But we are always reviewing those things and looking at what does that mean for the future and what does that mean for the future of developments as well. So it's really, really important that we're always following those things. And yeah, Pejman in our team would probably answer that way better than I am because he is specifically looking at that 24/7. But yes, yeah, there will be things that we need to look at, and actually probably less about the now and more about what does the future look like as we move forwards with new developments. Yeah, especially around AI.
Yeah, thanks, Anthea. Really interesting. So we've got one final statement in the chat, and I left this because I wasn't entirely sure what you were meaning by the question. So what it says is technology depends on the people who program the system, not just the supervisor. So I feel it's more of a statement than a question. But if you wanted to add to that, then please do send us a little follow-up and we will try and pick that up. Because I think, technology depends on everything that's being, connected, not only the infrastructure and the system, but everyone that's using it, the information that's put in and the engagement. So it is a sort of broad spectrum I think one of the slides said, it is what you put into it. And I guess that's very true. that is all the questions. I can't see anything else in the chat or the Q&A. So unless there's anything else to come through, we will wrap up the call there, and everyone can get 20 minutes of their day back, which is always a nice bonus cup of tea time, or go and deal with something else. So thank you all so much for joining us. Thank you to our speakers, to our panel. Really, really insightful session. This is Digital Care Hub. Contact details, if you want to get in touch with us, do fire us an email, give us a call, or reach out on LinkedIn. As I said, everyone will receive a copy of the recording, copy of the slides, and any other resources that we feel are necessary to share afterwards. So keep an eye on your inbox, and thank you all so much. We will hopefully see you all again. We do actually have another session tomorrow. So if you're still interested in other forms of sensor tech, do come along. We've got a similar session with Ali Cares, also looking with some of their providers who use them. So if you want a different perspective, then that could be really useful. So book online via our website. You should find the booking there. Thanks very much, guys, and speak to you all soon.
Thank you.
Bye-bye.